Alright, here's my audience.
Yes, I was.
According to the National Health Institute's website, in July 2011, 1 in 4 Americans have a condition that can lead to blindness, kidney failure, stroke, heart failure, or all of these, leading to death in some people. The Mayo Clinic's 2011 online guide states that increased blood pressure is often symptomless, and if left unchecked, it can lead to serious health problems. Diuretics, ACE inhibitors, and beta blockers are different types of medications that can work together to lower blood pressure. Each of them can overcome your human body's different tendencies to raise the blood pressure too high for levels that can be safe. People often take a look at all of the medications that they have to take and wonder, why do I have to be on so many different types of blood pressure medications? Along with regular diet and regular exercise and a good diet, most physicians prescribe a combination of medications to control their blood pressure. In this presentation, 3 medications will be focused on, as outlined in your handout: diuretics, ACE inhibitors, and beta blockers. Diuretics are usually one of the first medications that physicians focus on to help decrease blood pressure. Many patients refer to these pills as their water pills or their pee pills because they do cause the kidneys to increase the amount of urine produced, and because of that, decreasing the blood volume, it also decreases blood pressure. And the body has a pretty predictable response to this. The kidneys do sense that the blood pressure is lowered, and sometimes it will go ahead and release a hormone that will cause blood pressure to your blood vessels to constrict, and that will raise the blood pressure again. How dramatic this response will vary in individuals, but there are certain individuals that the blood pressure will go back high enough to be unsafe again. Since the blood pressure has been raised again, we have to take other steps and intervene with a medication called an ACE inhibitor. ACE inhibitors work to lower blood pressure. As part of our body's protective mechanism, that the kidneys do release that hormone that causes a chain reaction of a lot of other hormones, which all ultimately will raise the patient's blood pressure. ACE inhibitors break that cycle. ACE inhibitors block the angiotensin converting enzyme, which makes the blood vessels relax. The decreased tension in the blood vessels will decrease the patient's blood pressure. According to WebMD's September 2011 article, using ACE inhibitors improves the amount of blood pumped out of the heart per heartbeat, which then lowers the blood pressure. Sometimes your body will still feel as though the blood pressure that we've achieved is actually too low, even though it's now finally at a safe level. Because of this, the body will go ahead and increase the blood pressure in a number of ways. For a variety of reasons, the nervous system will sometimes take over at this point to make people's blood pressure go back up. Part of our flight or flight response in our nervous system is to increase heart rates and increase your blood pressure. This is great in an emergency situation, but it's not so good all day, every day. A medication that is used to control this response is called a beta blocker. Richard Laney, the author of Pharmacology for Nursing Care, states that the exact mechanism by which they reduce blood pressure is somewhat uncertain. Beta blockers lower your heart rate by blocking the nervous system response. It also relaxes blood vessels, but that's by an unknown mechanism. These two things together do decrease blood pressure. High blood pressure is a dangerous condition. Controlling it is essential in the long-term health of an individual. The amount of medications that the doctors need to prescribe can overwhelm and frustrate people. By understanding how the 3 different medications, diuretics, ACE inhibitors, and beta blockers work, it is easier for people to adhere to their treatment plan. Losing vision, being on renal dialysis, and losing function of one side of the body isn't something most people would want for themselves and certainly wouldn't want for their loved ones. By learning about the meds and sharing all they know about them, it could save someone all of these things and even save their lives.